Welcome back to my new series of presentation on the 4th chapter. This presentation is an introduction to reproductive health. And personally, I feel privileged to be able to discuss with you some aspects of reproductive and sexual health, which I believe will help you to not just know about the biology of reproduction, but prepare you to make responsible choices about sexual relationships that are fundamental to your well-being and in creating a caring world for all. The learning goals of this presentation are: 1. State the WHO definition of reproductive health. 2. Discuss the major challenges of reproductive health. 3. Describe effective strategies to prevent MMR, IMR, overpopulation, adolescent pregnancy, and STIs. 4. Name the curable and treatable STIs. 5. Determine high-risk behaviors for contracting STIs. And 6. Understand the benefits of early testing and treatment of STIs. Reproductive health is among the most fundamental aspects of our life. Yet, it often receives little attention because of social, cultural, religious, and political sensitivities. It's rooted in conservative values and long-standing social taboos. Teenagers and young people need to be aware of what's happening with their bodies and what are the respectful ways of treating your bodies and the bodies of others, and how to act responsibly when there's a decision to engage in sexual activity. And this is only possible if comprehensive sex education is conducted in an open and relaxed way by eliminating attitudes that promotes shame or fear of sex and sexual relationships. We need everyone, parents, families, teachers, communities, and young people themselves to stop treating sex education as a taboo subject. Sexual education is, if not the best way, a very important way in improving attitudes related to sexual behaviors and reproductive health. At the beginning, how can we define reproductive health? Yes, there are many and varying definitions of reproductive health. Even so, here's a definition endorsed by 165 countries at the WHO International Conference held on Population and Development, which states reproductive health as, I quote, a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, in all matters relating to the reproductive system and its functions and processes, unquote. This implies that reproductive health is not merely the absence of the disease of the reproductive system, but it includes people's ability to have a responsible, satisfying, and safe sexual life. There's a need to focus on the emotional, social, cultural, and moral dimensions of reproduction and sexual health. Let me discuss some of the importance of reproductive health. Firstly, reproductive health is a basic human right under the 1948 Universal Declaration of Human Rights. Reproductive rights are legal rights and freedom relating to reproduction and reproductive health. It recognizes the basic rights to all couples and individuals to decide freely and responsibly the number, spacing, and timing of their children, and the right to attain reproductive health services to do so. It also includes the right to make reproductive decisions free from discrimination, threats, and violence. Reproductive health is equally necessary to reduce maternal mortality rate, MMR, and infant mortality rate, IMR. Maternal mortality rate means the number of maternal deaths per 100,000 live births during a given time, and IMR means the deaths of children under 1 year of age per 1,000 live births. MMR and IMR are significant indicators of the health status of pregnant women and their newborns. 99% of maternal deaths occur in developing countries. In Africa and Asia together, it accounts for about 95% of maternal deaths. In the same way, IMR is higher in developing countries. Each year, an estimated 6.3 million infant deaths occur across the world. Now, the risk of maternal death is 5 times higher for girls younger than 15 years compared to women in their 20s. Early pregnancy, inadequate care during pregnancy, maternal infections, and unsafe abortions are some of the causes of MMR and IMR. MMR and IMR are preventable through promotion of family planning program and availing contraceptives so as to plan the timing, number and spacing of pregnancy. Likewise, prenatal, that is to say before birth care, and postnatal, after birth care of both mother and baby not only will reduce MMR and IMR, but also ensure healthy motherhood and childhood. To manage with any of the complications during pregnancy and childbirth, emergency obstetric care and professionals are to be made available. Furthermore, reproductive health is key to the management of exponential population growth. The average number of children that would be born to a woman over her lifetime is known as total fertility rate. Total fertility rate influences the rate of natural growth of a population. Fertility rates vary worldwide with approximately 1 child per woman in Canada, Australia and much of the Northern Europe to over 6 children per woman in parts of Asia and Africa. A fertility rate of 2.1 is considered to be an average number of births per woman required for a population to replace itself in the next generation. And historically, fertility rates continue at higher levels in less developed countries. So, what are the solutions to overpopulation? Well, some strategies could be funding family planning program or contraceptive methods across the countries, particularly in remote areas of developing countries. Additionally, women who are educated seem to be having smaller families and take charge of their reproductive and sexual relationships. Implementing government policies including ban on child marriage is indispensable. Over 50 million girls in developing countries could still be at risk of being married by age 15. Thus, they are likely to add more children over the course of their life. Now, to ensure the child marriage is completely eradicated from the society, the government of India enacted the Prohibition of Child Marriage Act, in which the minimal legal age of marriage in India is 18 years for girls and 21 years for boys. Now, the easiest and the most effective way to reduce unplanned pregnancy is contraception. So, what can be done to improve access to contraceptive methods? Some of the things that can be done are to raise awareness on modern contraceptives via both online and offline media, and at the same time, what's very important is to make contraceptives available at all public health care centers across the country. In fact, no barrier should be there for teenagers or young people in acquiring contraceptives. Next, Adolescent pregnancy is yet another problem which is seen in higher, middle or low income countries. At least 10 million adolescent pregnancies occur each year among girls aged 15 to 19 years in developing countries. And several factors contribute to adolescent pregnancy, of which the prominent ones are lack of education or dropping out of school, lack of information about sexual and reproductive health and rights, inadequate access to contraceptive services, child marriage, and sexual violence. As a matter of fact, adolescent pregnancy have several negative impacts such as premature birth, maternal infections, pregnancy complications, maternal mortality, low birth weight of babies, and end of education opportunities. Now, the best solution to prevent teen pregnancy is to integrate comprehensive sexual education. Studies show that countries that have comprehensive sexual education, like the Netherlands, where sexual education begins in preschool and is integrated into all levels and subjects of schooling, have the least teen pregnancy rates in the world. Another big challenge of reproductive health are the STIs. More than 1 million STIs are acquired every day. While anyone can become infected with an STD, certain groups, including young people, are at greater risk. Attempts to stop sexual education or censor information about condoms or birth controls are not at all an effective strategy. It's a dangerous and irresponsible approach to deny the sexual and reproductive needs of adolescents. And my last point is infertility, which is the inability to become pregnant even after 1 year or more of unprotected sex. It creates a great deal of stress to couples intending to become parents. It affects their social and psychological well-being. On the negative side, in some societies, infertile women are excluded from certain social activities, sent back to their parents, or even have their marriage ended irrespective of the cause of infertility. Yet the field of reproductive medicine is rapidly growing with innovative, safe and cost-effective solutions to infertile couples. Assisted reproductive technologies, or ARTs, comprises of several range of procedures that can help infertile couples to have their baby. And we are going to be learning some of such ARTs in our upcoming lesson. Now, from all of the above points, it becomes all the more clear why comprehensive sexual education is a necessity to all, especially to children and young people like you. The knowledge, skills and values that you learn through comprehensive sexual education should empower you to make informed decisions about your well-being and help you to develop respectful social and sexual relationships. The choice that you make as you transition into adulthood would affect your own well-being and that of others. Being sexually responsible involves respecting your partner and taking precautions against sexually transmitted infections and unplanned pregnancy. Always remember that it is your choice. No one can ever force you to engage in sexual activity without your consent. Reproductive health is all the more essential as STIs continue to be a significant public health concern. So let me now discuss some aspects of STIs. Sexually transmitted infections, or STIs, are infections that are spread predominantly by sexual activity, including vaginal, oral and anal sex. They are also called as sexually transmitted disease, STD, or venereal disease, VD. Some STIs like chlamydia, gonorrhea, syphilis, hepatitis B and HIV can be also passed from an infected mother to her child during pregnancy or delivery. It is therefore absolutely necessary to screen pregnant women from these infections so that they can receive timely treatment for potential STIs. STIs are caused by bacteria, viruses, fungi, and some protozoa. Bacterial STIs include chlamydia, gonorrhea, and syphilis. Viral STIs include HIV and AIDS, genital herpes, genital warts, and hepatitis B. Trichomoniasis is a parasitic protozoan STI, and vaginal candidiasis is a fungal STI. Now, names of the specific pathogens causing these infections are also included in this table. While anyone who is sexually active is at the risk of getting an STI, certain behaviors can increase the risk of contracting STIs in few groups, like commercial sex workers, people with multiple sexual partners, drug abusers, and young people who indulge in early unprotected sexual activity. What's more concerning is that we can get STI from a person who is showing no sign or symptoms of the disease. That said, if symptoms appear, they can typically include one or more of the following: abnormal discharge from the penis or vagina, itchiness around the genitalia, burning sensation or pain when urinating, rashes or sores on or around the genitals, unusual bleeding not associated with a female period, and pain and swelling in the testicles. However, I must emphasize that these symptoms don't always mean an STI. Other health problems can also cause such symptoms, and the only way to know for sure is to get tested. Getting an STD is not the end. Many STDs are curable and all STDs are treatable. Treatments for STIs depend on the type of infections. STIs caused by bacteria, fungi, and protozoa can be cured completely, whereas viral STDs can be managed or controlled but are not completely curable. Antibiotics can cure many sexually transmitted bacterial and parasitic infections such as chlamydia, gonorrhea, syphilis, and trichomoniasis, while antiviral drugs are prescribed to treat viral STIs, which are effective in controlling the viral count from increasing and thereby improving the quality of life. However, HIV, hepatitis B, herpes, and genital warts are all not curable currently. If STDs are left untreated, it can lead to serious complications. Possible complications of STIs can cause pelvic inflammatory disease or PID, which is an infection of one or more of the reproductive organs in women, causing scar tissues to develop in the reproductive tract. Or it can also lead to ectopic pregnancy, where implantation of embryo can occur outside of the uterus, and it occurs most often in the fallopian tube. In addition, STIs can also be the cause for miscarriages or loss of baby before 20 weeks of gestation. Similarly, sterility too may be caused by STIs where the males are not able to cause pregnancy or a female is not able to become pregnant. In the long run, STIs can also lead to cancers of cervix, prostate, and rectum. But the good news is STIs are highly preventable. There are steps we can take to keep ourselves protected from acquiring STIs. And some of the effective preventions are to completely abstain or not indulge in sexual activity for 100% protection. The easiest, cheapest and the most effective way is to use latex condoms. Now, they need to be used consistently and correctly during each sexual act. Condoms are proven to be 98% effective in protecting against most STIs. However, condoms cannot be protecting against genital warts, herpes and syphilis, which can be spread from skin-to-skin contact of genitalia. It is equally safe to limit your sexual partners, and monogamy may be a strategy to prevent STIs. That said, both partners in a monogamous relationship must get tested and be loyal to each other. There's also a body of evidence supporting the close association between drug use and having STIs. Drug users are more likely to engage in risky behaviors such as sharing of needles or unprotected sex with multiple sexual partners. As STIs have no symptoms most of the time, testing becomes the only way to know for sure and to prevent from giving it to other people. And finally, there are 2 vaccines currently available which can effectively protect us from hepatitis B and genital warts. HPV vaccine is available to prevent from human papilloma virus, which causes genital warts and cervical cancer. 2 doses of HPV vaccine is recommended for all boys and girls at ages 11 to 12, and it can also be given as early as age 9. HPV vaccine is also recommended for everyone up to the age of 26 years. Yet, adults between the age 27 through 45 years who are not already vaccinated can get HPV vaccine after screening. And HPV vaccine is safe and very effective in preventing not only genital warts but also cervical cancer. Now, the second vaccine available is hepatitis B vaccine. It's recommended for all infants at birth and for children and adults if not vaccinated already. And this vaccine can give us protection, a lifetime protection from hepatitis B infection. So with this, I come to the end of this presentation with a motivation for strengthening your reproductive health and nurturing responsible and empowered adolescents who will create a healthy and happy life for all. You are the greatest resource of a society. So be safe and see you again in my next session.